Once the implant has been successfully restored and the implant crown or bridge has been inserted on top of the implant or of the implants, then it's very important to look after it properly. We're going to show you how to do so. We have a space in between the implant tooth restoration and the gum, and that should also be kept clean. Just using the brush itself, you won't be able to penetrate the toothbrush brittles into that cap. That's where the dental floss or dental tape goes in. So you take a piece of string that's stretched from your fingers to your elbow, you roll most of it on the middle finger of one hand, and then leaving the other bit to the middle finger of the other hand. So most of the floss is on one side. What you then do is you insert the floss in between the restoration and the natural tooth, and once you've passed the contact point, like I just did there, you press the floss against one of the teeth before going down into the gum, and then you go up and down 1, 2, then you take it out slightly, you press against the other tooth, you do the same thing, 1, 2, you take it out. The piece of string that was used, you roll on the hand where you have the less floss, and you unroll to get new fresh floss, and you go to the next gap. So you penetrate the gap between the two teeth, you press against one of the teeth, 1, 2, 1, 2, then to the other side, 1, 2, 1, 2, so making sure that underneath the implant restoration is all kept clean. If you found that it's too fiddly, an alternative is to use interproximal brushes. These interproximal brushes, they're color-coded according to their size. So starting from the smaller size, you'll penetrate into the gap with the brush all the way in and then out, and you'll do that on different directions to make sure that you get all the corners and the angles underneath the implant restoration, and you do the same thing on the tooth next to it. You then take it out. If you find that the gap is big enough and that it's quite easy to get in and out, you can then move on to bigger brushes until you find the one with the right size. So again, penetrating the gap all the way in different directions until you find the right size. Once you've done the interproximal cleaning, you can then go back and just do your normal brushing. So using a manual or electric toothbrush, you do a 45-degree angle into the gum and you just go back and forward, keeping the outer surfaces all clean. Once the implant has been restored successfully and the treatment has finished, if well looked after with your daily oral hygiene, the implant should really last many, many years.